this session and the things that we're going to be talking about today and follow up, and for those that can't join us. So I've just started that recording now. We're going to be launching the Idaho CHW Network WhatsApp, and I'm just really excited to introduce Anna Estrella and Erica Niner. They're both CHWs and in related positions in different parts of the state. So Anna's from Mountain Home area, and Erica is in Southeast Idaho here in Pocatello, where I'm at. And they're going to walk through what the Idaho CHW network is, how it's working, how it's hopefully going to work for us, and then how you can join it and participate in the new network. So I'll let them maybe add a little bit more to their introductions, and I'll turn the time over first to Anna Estrella. So Anna, are you on?
Hey guys, I am on. Don't you guys just
Yay.
love my chat GPT picture? I love it. I just love it. I was having too much fun with that whole program. I've never used it, but anyway, neither here nor there. So, my name is Anna. I am a community health worker at Desert Sage here in Elmore County in Mountain Home, and so I'm super excited for the launch of the WhatsApp communication for CHW's network. Or I guess I said that wrong. It's the Idaho CHW network. Um, I'm super excited. It's going to be a space for CHWs throughout the Gem State to connect, to collaborate, and just to talk to one another and really share their toolkits, what's happening locally, what's happening statewide. So it's super awesome. And I'm just asking for grace because this is a CHW driven platform. So we are going to be growing and learning as we go. All right. So this network is a collaborative effort with ICHWA, the Idaho Community Health Worker Association, and with ISU. This partnership is super, super awesome. I know throughout conversations, being at the mini collaboratives, we all asked for something like this. So now we're actually getting our foot on the ground and getting it moving. So I'm super excited. The mission is just to pretty much get CHWs to talk to each other, to grow, to evolve, and have an open space to speak freely and just learn off of each other. So I'm really excited about that. And oh, I'm so sorry. I lost my train of thought. Sarah, do you mind helping me with this one?
You're totally good. I mean, as Anna kind of mentioned, we've heard a lot of different conversations over the last, few years really about the need for like a real-time statewide connection tool. Because like we all know of each other, we've seen each other at the learning collaboratives, we maybe know of each other's organizations and like the things that are in each region. But we just needed something that, you could put out a question and like boom, like there's an answer because someone can in real time like say, "Oh, well, I had that kind of situation too, and in this area this person helped me. Maybe there's something similar in your area." Something that could be a resource. And just like the connection, when we had our ICHWA presentation, um, or when ISU had our discussion that we facilitated in April at the Learning Collaborative, it was really apparent that and we did some research and evaluation, and a lot of CHWs felt like they were on an island or like kind of isolated. And so this hopefully is a tool that we can, the vision is that maybe it gets people off of that sentiment of being alone when you're doing a work that really is contributing to your communities, and people are doing it all over the state in different ways. And so kind of feeling that collective, power that comes from being in a network. And I'll let Anna talk about that bolded line right there at the bottom of this slide. But hopefully that kind of orients everyone to like what the vision is.
And I just want to add, like, as a CHW, I want to empower other CHWs. We come with a lot of expertise of our area. And so being able to have a platform where we can talk to each other and encourage each other and maybe get some guidance because our employers sometimes do not understand like what we're dealing with. So getting that communication and that live action answers is really going to be something that's going to be encouraging and really help us grow within our positions and our roles. As we progress, the network may adjust. It's going to grow. It's going to change, and we're really anticipating growing pains. However, those growing pains are what's going to make this platform stronger. So your input is very much needed. Just be respectful, be kind, and let's keep it moving so that it can evolve into something beautiful.
Yeah. And I know I already mentioned the HWA Learning Collaborative, which I guess I can just point these out for Anna before we like move on. But there was definitely a consensus for like state and regional connections, which HWA is like working on building, a regional champion for each area, somebody that so there's like a lot of movement in this kind of connecting space. And there was a collective desire to just be connected with some side of a group messaging tool. And so with some, input from that conversation, and then, we are moving forward with this WhatsApp community. And it's a collective effort from ICHWA and ISU and obviously the CHWs that are participating to kind of address that need. And as Anna said, like there's going to be technical things. We're going to like try out some notification settings. We're going to, be adjusting and growing. And just, if there is something you run into, we're open to constructive feedback. I say constructive because we don't, you don't need to be mean. We're trying our best. Um, but hopefully we all feel like you get to participate in a meaningful way and then see it evolve. I like to call it like hopefully like it's going to be a living organism that like grows and develops and changes and adapts over time, and the needs of our communities. So, um, I think, Anna, is there anything else you want to add before we turn it over to Erica?
No, that's it. Now we're going to get into the nitty gritty, Miss Erica.
Okay, awesome.
Yay! That's my responsibility. Woo. Um, I'm Erica Niner. I was born and raised in Pocatello, and I've been very dedicated to peer and youth support work for over 5 years. Um, I got into community health because it was a binding of my two worlds and my experience. So I focus heavily on lived experience, trauma-informed care, person-centered care, to make sure people are finding what works for them and moving forward with their own journey, their own path. So I do a lot of that work through different spaces, and just using my lived experience of being a person living with a mental illness, as well as being a person that lives with a chronic illness. So that's why I find community health work so beautiful. And I do a lot of that work through NAMI, the National Alliance on Mental Illness. So we've started our Portland Valley affiliate, so we're spreading, and hopefully, we can all collaborate at some point. But with that, let's get a deep dive into kind of the demo of it all. So, if you want me to share my screen.
Yes. And I see some chats that maybe folks are having a hard time hearing. Is the volume okay for everybody? I'm not sure. You might want to check your personal settings and make sure that you have your volume turned all the way up, for those of you that may be having issues. So, thanks. Go ahead, Erica. I'm seeing that there's some, yes, thumbs up. So, okay, perfect.
In in the chat, I'm gonna throw out the link to join, just so it's there already. And then let's see. Share my screen. And first off, I just want to show kind of how that process is gonna work. So, say you have your browser. I have mine open in a guest browser so that because I'm already logged in. So you just copy that link in. We'll also show some QR codes here in a minute.
Mhm.
And it should hopefully see it's trying to open on me. It should look like this. This is for the behavioral health group chat. We have um, a couple different subgroups. So we have the behavioral health subgroup and then the self-care space, which I'm super excited about. It's going to be a lot of fun. So if you're continuing on web, which you will need to download the app on your phone, um, or you can download it online. But if we say, let's continue to the WhatsApp web page, it's going to look like this. And then it's going to bring you to this page. So this is where you're going to need your phone at some point, because you can either scan this to log on once you've logged on your phone, and you need a phone number in order to log on or in order to set up an account. And then you can do it this way and log in with your phone number. So I'll just show how that works real quick.
Okay.
And now it's going to bring you to this page. So you'll get a notification on the app on your phone, and you'll type in this code, it will connect. It shows, the different settings for iPhone, Android, but once you're in, close that. Let me share my other thing. Okay, once you're in, oh, that's my chat with Sarah. Well, here's what it looks like when it pops up. So you're gonna go, once you scan the QR codes, it should open up these communities for you. So this is the main community. This is just the communities page, but this is the whole community. And then under this community right here, there's the announcements, which will be from us, the admins. So we'll figure some of that stuff out and see how it works as we go along. And then you'll see the groups. So these are the groups. And we have the general chat, which we have posted here, the general rules and group guidelines. We're still working out some stuff on how we're going to have these posted, but if you go to group info, this is for notifications. So if you go to group info, you can also see the description here about what it is. You can go to notification settings. You can mute notifications for 8 hours a week, always. And I would recommend, especially on your phone, the default setting for your notification tone on your phone is your just normal text tone or ringtone. So a tip I would recommend is changing that tone so you're not getting confused with a text from your actual number and a text from WhatsApp. And if anyone has any questions about the stuff on the phone, there is a little bit more to do on there, but you can always reach out to me and we can go over that. I have some other stuff where you can mute so you're getting limited messages and stuff like that. But just like within every group, we have here our group guidelines, and we're gonna go over those in a minute. Is there anything else I'm kind of missing, Sarah?
Yeah, I was
Oh,
just gonna add kind of a cool point is that the way that the communities are set up in WhatsApp, and this is part of why we liked this platform, is everyone can be a part of like the main overarching group and get the announcements like that come from the admins from HWA and ISU and any other announcements. But then with the groups, like you can pick which groups you want to be a part of. So for now, we have the behavioral health like group, we have a self-care space, and then there's the general chat. But like if there's a topic that's maybe like less interesting to you or less relevant to your position, you don't have to join that group. So you won't get all of the notifications from that group, if that makes sense.
Yeah.
Or if you're interested in all of them, but like maybe at different times of your work, you'll have one that's more relevant than the other. You can like mute notifications for one and turn them back on for another. So that way, we're really respecting the weight of having notifications like coming through, because we know you're balancing a lot of things in your different workplaces and different positions. So, that capacity to be able to control your notifications and like decide what kinds of spaces you want to be getting notified about, is really helpful. So hopefully that's a good point to make for
Yeah.
everybody.
Yeah, definitely. And one other thing is like this number, this is one of the people that we're working with. I've changed everyone, I believe.
Yeah,
So your number won't show up like this just because we're admins. We can see the full number. But if you want that to change for yourself, because seeing everyone's name differently can be a little confusing, like what I've done with Liz and Ben here, is you can just go to the group info, scroll down to one of the members, and like say if this person, oh, I don't have them in my contact, right? I can say, oh, I'm gonna add them to my WhatsApp contact, and this is Maya, right?
I think so, yeah.
I'm just gonna hope that it is. And that way, and you can sync it to your phone, but you don't have to, which I think is really nice. And then you can just, oh, let's see, this thing is in my way. Can I move? Is there a little enter button down there that I can't see?
There's a check mark. Yeah, it's probably right under your
Right, it's right under my screen here.
your
Let me
share
see if
thing.
it's. Anyways, you can do
You can
that.
hit that green check mark and it would save, but it's okay. You can go back
Yeah,
out of that contact and I think people understand.
and
Yeah, and I think that that's a good point, Erica. So like obviously Erica's sharing, she's an admin, but one of the other nice things about WhatsApp is that it doesn't share your number with everybody. So that's a general group member. It'll just be public to the admins. So right now the current admins are me, Erica, and Anna. And I think Maya may also be an admin just in her role in ICHWA, but um we will, protect and like be private with numbers. Like they're not something that we'll be sharing. And so it kind of is a way that you can connect with people without having to like, hey, here's my personal cell. Like, here's my number, like text me anytime. No, like it's a little separate from that. So that this network can be a private, secure place for you to you know, chat about things that maybe you need resources for. So back to Erica.
yeah, absolutely. And each subgroup has a little bit of different guidelines, but we'll go over that in a minute. But the general guidelines are all the same, and I'm sure we all know keep it respectful. If you want something that's you don't have to go through every single group and say, turn off notifications. If you don't want notifications at all, you got to go to your account, which is down in this corner, and you just go to notifications for messages. You can turn that off. I think on the mobile app there is an option to turn off some or stuff like that. That's not an option online. I'm not sure why, but you can turn it off however you want here. Um, or just groups in general. So that's that. Also, if you have any questions, there's also help and feedback. So there's the help center.
Mhm.
And you can type in whatever. It's a little confusing. So, like I said, feel free to reach out to me because I've read through pretty much the whole thing.
Yes. And I was gonna say like where me, Erica, and Anna are the admins, like we're the ones that approve those. I saw a question come through about approval for joining the group. Anna, Erica, and I are just doing this. They're going to be doing it on their time, so probably like once a week they'll go through and accept requests or as they see them, do that. So after this meeting, I'm guessing we'll be admitting a lot of people all at once. Or if Erica or Anna are on it, like during this
Yeah,
meeting, you might see it go through.
that's
Um,
totally good.
but It'll come in waves and we'll probably have a big wave at the beginning and then like people kind of trickling through afterwards. Feel free to share this information with those in your networks, because I think the more the merrier with some of these features, like the more people that can be connected, I think the more useful it will be over time. But yeah, and we are happy to support you if you have technical questions, to an extent. Like we're also not IT, hopefully someone nearby you is familiar with WhatsApp. You can have somebody help you download it, install it on your desktop. Make sure that if you're using like a work computer or a work phone, that you maybe have approval from a supervisor to do that. Otherwise maybe keep it on your personal cell. Utilize whatever is appropriate for your workplace. And then I'm going to reshare our slides because we have some more little notes to just talk about before we wrap things up.
And I
Um,
I just want to say, as you're pulling that up, like
yeah, go ahead.
I'm super excited about the self-care space. Like it's gonna be fun. I mean, we'll have these other spaces to, talk about like resources and stuff like that. There's the link. But
Yeah, there's the QR code.
the self-care space is gonna be for us. We work really hard in healthcare, and we take care of like a lot of other people. So it's a space for us to just kind of have fun, a safe place to share recommendations for self-care and just do check-ins. So
Yeah.
it'll be a lot of fun.
Perfect. So there's the QR code. We can share it again in a follow-up email. We'll send this recording and then all of the slide information out, probably tomorrow afternoon. So, I'm going to move on to the next slide, but if you need us to come back to it at the end, we totally can. Um, Here you go, Erica. If you want to just introduce quickly the two sections and then,
Yeah, yeah. So the behavioral health um, is not going to be too different from the general chat. I mean, it's just going to be more specific to behavioral health. So it's going to be a place where we can share resources, we can solve problems, without giving out any like personal health information, of course, respecting confidentiality. We can navigate the different kind of systems that we deal with in behavioral health because there are some big differences between general physical health care and specifically mental and behavioral health care. So we'll be able to have more direct links to behavioral health and also like any trainings, right? Because what might work for a physician might not work for a counselor or something like that. And the only thing, like one of the main differences that I threw on the guidelines is a comfort agreement, just so we know in behavioral health that sometimes topics can get a little heavy. There are sensitive topics, so we want to make sure that we're not re-traumatizing ourselves or being disrespectful to other people's positions or professions. And then definitely in addition to this one, which is in addition to the other one, is crisis protocol. This is not going to be a 24/7 monitored chat. So please do not put crisis in here. Like if you're dealing with a crisis. Number one for confidentiality and number two because we might not be able to help. But in that section, there's a crisis and referral, some quick links, so 988, 911 if necessary, and you'll see that in those group guidelines. And yeah, we are mandated reporters, all of us, so keep that in mind as well. And then the self-care space. I'm so excited about this one. It's going to be really exciting. So this is something that I did when I did my recovery coaching training, and we checked in every day, and it was really awesome. And I have some really fun ideas. So But it's just going to be a space where we can check in, and you can check in however you want to. You can check in daily, preferred, preferably. I would enjoy that. But weekly, monthly, just whatever fits your capacity. Like don't stress about it. It's no pressure. This is just a safe space. And we're gonna celebrate each other, and set intentions. So any self-care wins, I don't care how big or small, if it's, hey, I put pants on today, or I got that promotion at work, we're all going to celebrate each other for those things and set some intentions. I think it's really helpful for me to, at the beginning of the day say, I'm gonna crush it today, or and just put that out. Again, no matter how big or how small, and there's more on that in there. And then asking, asking advice. What do you do when you're feeling burnt out? And we can help each other in preventing that burnout. Um, no unsolicited advice, please. That is also in the group guidelines. If we see any unsolicited advice, it will be removed. So make sure you're being culturally sensitive, respectful, and everything. And then, yeah, just sharing what tools work for you. So,
Sorry.
no, you're good. It'll
There
be
you
it'll be a nice space. And then both of the subgroups still attach onto the main group guidelines, like Sarah's going to show on the next slide.
Yeah. Um, And I just want to, I mean, we have these, like Erica said, pinned in the like main group and some of the subgroups, which we'll probably need to repost them as people join. So bear with us as we kind of like get our momentum going with these first people that are being added. But everyone's probably joined a Facebook group or community and like had admins that had to kick people out. And I am saying on behalf of Eric and Anna, they really don't want to do that, but they do have the right to do that if somebody is not like complying with the community guidelines, especially with strict privacy and HIPAA compliance rules. So, there's going to be a zero tolerance for that. So just be aware if you have a situation that you're wanting information or have questions about, keep it vague, keep it general. Don't share those personal health information pieces that are a part of HIPAA and privacy, standards. So. Anyways, I'll turn the time back over to Erica to finish out maybe chatting about these guidelines.
Yeah, do you just want me to pull them up real quick? Let's
Yeah,
see.
if you have them
Yeah.
in a place that's easy to share, you can totally share that.
Yeah, they're just on in my WhatsApp anyways, right here.
Perfect.
So you get messages from y'all. Hopefully, I
I
don't
was gonna
miss it.
say,
I was just gonna say too, I hear the pings. I love the
I
pings.
know. It's exciting for us.
So here is the behavioral health um, guide or group guidelines. So as you can see, just kind of the purpose, and then of course the comfort agreement. So we're going to honor each other's scope of practice. There are diverse roles. We all know that behavioral health is a huge umbrella of roles. So make sure you're only sharing advice when appropriate, of course, and requested by someone else. So it's not, and also we are not diagnosing people. This is not a medical chat. We're not diagnosing, we're not giving medication recommendations. We are sharing experiences with altered details, and not violating HIPAA, like Sarah was just saying. And then, yeah, just here are the crisis referral quick links. I have some more that I'm going to add. Please feel free to add more for your region so that we
Mhm.
have those, if we need them. That's going to be a huge resource. And let's see. So just for the general chat, it's same thing that we were just looking over. So it's all here. Like Sarah was saying, we're gonna have to figure out a way to pin it. We might be doing something like where we repin it weekly, or something, just so it's there, because the pins do disappear after a while. But it's all here if you want to see it. We could also make a trying not to get names. numbers. So here's our self-care space, and it talks a little bit more about like examples, sharing your self-care, so the 8 dimensions of well-being, whether it's physical, psychological, emotional, spiritual. This is a non-denominational chat, so just practice that cultural sensitivity um, when you are sharing a spiritual self-care win, and that says that here as well. Like, religion can be a big part of a lot of people's self-care routines, so we want to support that for sure, but just practice that cultural sensitivity when sharing those as well. No unsolicited advice, like I said, and this goes in a little bit more, just respect unique circumstances. I think that goes for the whole community as well. Um, we're not going to judge each other for how big or how small a win is, or for, asking a question. All questions are welcome. And most importantly, we want to hear from you. So, like we've said probably 3 times by now, I don't know. Uh, we want to hear from you. Please let us know if there's anything that you want that could be changed, if there's something that's concerning or bothering you, big or small. Um, let us know. We're here to work through this together. We're in the beta mode of getting this up and running. So keep that in mind. I will repost these as well because probably everyone that joined can't see them again. But I think
That
that's all
covers
I've
it.
got.
Awesome. Okay, I'm gonna reshare my slides again. And in the last 10 minutes that we have together, um, I think the next thing I had on here was just like if there's any questions or thoughts, kind of as we have gone through a lot of information today about how to join, things like that. If anyone's ran into anything that's are, are the links working? We want to know. So I mean, I've had my WhatsApp open and I've seen a lot of requests come through. Um, but if you do need something, I believe there's a way Erica can maybe tag onto this. If you do need something like through WhatsApp, I think you can message just the admins or like reach out just to the admins somehow.
Oh yeah, yeah. Just in the chats, you can just
Mhm.
or if
You
you
can
go on the
tag
group where
us
the
too.
members are, yeah, like we showed, just you can
Yeah, you can message us directly if there's something that comes up that's concerning. Oh yeah, that's a good point, Susie. Let me get back to that. So this is the big group, and once you join the main group, you can add yourself to like the subgroups as you would like. But we imagine kind of in collaboration with ICHWA, if there's at the quarterly partner meetings with ICHWA at these mini learning collaboratives, if you have a suggestion or an idea for another group that we should open up, if it's about transportation or like one of those other big topics that people are trying to work on and connect over, we are happy to add more groups. I mean, I don't think we want there to be more than like 10 over time, but we'll kind of be adjusting. And that's part of what we say about like the learning and growing piece of this. But I just put the code back up and I'm getting a lot more requests coming through. I'm sure Erica and Anna are too.
yeah. Anna's saying it.
Um,
We don't talk about it.
Yay, Kara says, This is great." Yes, we hope it will be. And we appreciate everyone kind of collectively participating and like pitching in and, working to make it be what we maybe envision it to become. So, any last comments or questions in the last couple minutes? Otherwise, I'll share the evaluation link in a minute. But
I'm gonna be putting some fun prompts in the self-care chat, that's for sure.
yeah.
Got plans.
And I guess I could say that too. Erica will be primarily, moderating the self-care and the behavioral health spaces. That's where a lot of her experience and expertise comes, and she's been great to like add those comfort clauses and the different, the crisis lines and things to those spaces so they're safe. And then Anna's going to be moderating more of the general chat, and then maybe as more groups get added we may be needing some additional moderators and admins. So, if you want to participate or volunteer or support this, down the road, feel free to let us know too. So, um, if that is everything,
One
yeah.
other thing. There is WhatsApp is rolling out over the next couple months usernames.
Yeah,
So if you want, you can search that in your settings and it should pop up, but um you can have like your own username if that makes you feel more comfortable than having like your number or whatever. So just wanted to put that out there as well.
perfect. I'm seeing that a code didn't work. Was that the QR code not working? Um, okay, let me reshare the link in the chat
Yeah,
and
here
maybe from,
I have it copied and pasted already.
okay. Yeah, both me and Erica just shared it in the
Make sure
chat.
like looking at it, make sure it's the same one.
Yeah, I was gonna say I think it is, but and then what I will do as well, like if you're unable to get this all logged in right this second, um, I'll be sending out like a follow-up email from this meeting. So as long as you like registered for the meeting, you would get the follow-up. I'll send out like the QR codes, a link to join these slides again and the recording so you can walk through kind of what we've talked about and share it with anybody else that's interested in joining. Um, but we're really excited about this effort. So let me just share the evaluation slide in the last couple of minutes here. If you don't mind just filling this out, it'll take like less than 2 minutes to do it. And we are super grateful for everybody and the way that they've contributed to kind of this culmination of ideas and bouncing off what needs we have in the state so we could build this network. And yes, we will be sharing the slides um, as we follow up, send out a follow-up email. So, anyways,
And the self-care group doesn't require like a approval to join.
you can just join it.
You can just join
Perfect.
it.
So if you're a part of the main network, you can just join that
Yeah,
one.
you can just join it.
So, okay. Thank you all so much for your time today. We know it's a busy time of year, so hang in there, stay cool, stay hydrated, and check in on your self-care group now that you're all added and share how many ounces of water have you drank today? Just kidding. Or coffee. No. Thank you, everybody, and we'll see you next time.